Hello, I'm Lucas, and today we will be talking about alternative pain management options during labor other than epidurals. So we have our birthing mother here, Zach, and Zach is giving birth to her first child. So in overview, some patients just don't want to have an epidural during their births. For whatever reason, they just choose that is not the option they would like to use. So we'll be talking about some alternative methods like music therapy, hypnobirthing, and hydrotherapy during labor. So some statistics, pretty much every mother feels pain during birth. It's a very painful experience, with over 23% of primiparas describing this pain as unbearable. So it's very important to use some sort of pain relief method during labor. Some signs and symptoms of pain are spoken pain, like using a numeric scale, grimacing, yelling, crying, and elevated vital signs. A good diagnostic tool to identify this pain is the numeric scale from 0 to 10. So, Zach, on a scale from 0 to 10, how would you rate your pain right now?
10.
10. So, let's try to get this mother some therapy for her pain, other than an epidural. So first, we'll talk about music therapy. So the use of music therapy throughout the whole course of labor shows a moderate level of statistical evidence towards decreasing pain and anxiety, according to the National Library of Medicine. So we'll get some music rolling. So we would be having this music play during the whole course of the labor to also help decrease that fear and anxiety, like before the bad contractions start and the baby starts to come out. So this is one of our mother's favorite songs, and it's gonna really help her feel more comfortable during this labor. So how would you say you're feeling now? How would you rate your pain on a scale from 0 to 10?
Like an 8.
An 8? And then are you feeling like lowered anxiety?
Yeah.
Yeah, good. All right. So, seems that one was working for our mother, but we'll move on with something else now. So, moving on to the hypnobirthing now. While the National Library of Medicine only showed a very small level of statistical evidence towards this working, according to Hypnobirthing International, patients report lowered pain, shorter labor, lowered fear, lowered postpartum depression, and other positive effects as a result of hypnobirthing. So here, I myself am not a licensed hypnobirthing instructor, but I'll just kind of simulate it for you. So before we start the hypnobirthing, where would you rate your pain on a scale from 0 to 10?
Like an 8.
And then how bad would you say your anxiety is, like mild, moderate, or severe?
Pretty severe.
Pretty severe. All right, so then we would get into the hypnobirthing. This is pretty stereotypical, but I'm not a practitioner again. So, all right, and then we could reassess. So where would you say your pain is on a scale from 0 to 10?
Like a 6, doctor.
6. Not a doctor. You must still be under the hypnosis a little bit. So then where would you say your anxiety is now on a scale from mild to moderate to severe?
Good question. Probably moderate.
Probably moderate, so that's less than severe. That's good. All right. So then moving on, we'll be talking about hydrotherapy next. According to the National Library of Medicine, hydrotherapy has been shown to significantly reduce pain during the course of labor. So it's been proven to help with positioning, as you can kind of free float around in the water some. Now, our mother would be laying down completely submerged. Well, not completely, but mostly submerged in the water. But she doesn't seem to want to do that right now, but that's okay. Hydrotherapy can help with moving and position changes, as well as just a sense of comfort in the warm water to help reduce that pain. While I've only highlighted a few, there are many alternative methods to pain management other than receiving an epidural. It's also important to note that combinations of these therapies might have better outcomes over choosing just one or another. A popular combination of these being hydrotherapy and oral pain medication. In the end, make sure to discuss with the healthcare team helping you deliver your baby about what options might be best for you.